So, good day, everyone, and welcome back to Critical Analysis and Nursing Scholarship. In today's session, we're going to focus on non experimental research design. Now, before we start with our new topic, let us first have a very short review of experimental research design by answering these questions. Which descriptions accurately characterize the design of a research study conducted in a laboratory setting incorporating four groups, two control and two experimental, where only one experimental group and one control group are pre-tested, while all four groups are post-tested? Select all that apply. A. Experimental design. B. After only experimental design. C. Time series design. D. Quasi-experimental design. E. Solomon four-group design. There are two answers in here. This is an example of a Solomon four-group design, and at the same time, it is a quasi-experimental design. The next question is, the nurse researcher intends to assign patients attending Clinic A to the experimental group and patients attending Clinic B to the control group. The research aims to answer the question, does a mindfulness eating program decrease weight in overweight in adolescent girls? What type of research design would be used? A. Non-experimental. B. Experimental. C. Both experimental and quasi-experimental. And letter D. Quasi-experimental. The answer is letter D, quasi-experimental. If you try to look at the design of this study, there was no randomization that has been conducted. Instead, patients were assigned according to the clinic where they were attending, such as Clinic A and Clinic B. Thus, the answer is quasi-experimental design. For today's session, we're going to focus on non-experimental research design. Specifically, we're going to discuss what are the different types of non-experimental research design, and we're going to assess the pros and the cons of non-experimental designs in healthcare and nursing research. To start with our discussion on non-experimental research design, I want you to look at these four research questions. I want you to examine the independent variable and the dependent variables. And after examining each research question, I want you to tell me which type of research question or research designs rather is most applicable in each type of research question. Let us start. Does telephone counseling intervention for patients with prostate cancer cause improvements in their psychological distress? This research question can be best answered by an experimental research design, because in here, we can actually manipulate the independent variable by introducing telephone counseling intervention and see whether it causes some improvement in psychological distress. How about number 2? Do birth weights under 1500 grams cause developmental delays in children? The independent variable is the birth weight, and the dependent variable would be the developmental delays. The answer is non-experimental. In here, try to look at the independent variable, which is the birth weight, and you would notice that this type of research design, it would be unethical to manipulate the birth weights of children to see whether it has significant correlation with their developmental delays, hence non-experimental research is used. Try to look at research question number 3. Does salt cause high blood pressure? Now, I want you to look at the independent variable. Do you think you can manipulate salt intake just to check whether it can cause high blood pressure or not? In this type of research question, it is unethical to increase salt intake just to see whether or not it causes high blood pressure, and hence we utilize non-experimental research design. How about number 4? What is the stress levels and sources of stress in frontline nurses during the COVID-19 pandemic? The answer is non-experimental design. And here, it doesn't involve any manipulation with the variables. There's no control group in here, and certainly there's no randomization. Hence it is non-experimental research design. Given the research questions in the previous slides, we now know that in nursing research, not every question can be answered by manipulating variables or conducting experiment. Some questions involve characteristics, behaviors, or naturally occurring phenomena that cannot be controlled, such as research question number 4, or ethically altered, just like research question number 2 and 3. This is where non-experimental research designs become essential. These designs allows us to observe, describe, compare, and analyze relationships as they naturally occur without intervention from the researcher. Our next few slides deal with the different types of non-experimental designs with nursing examples to help you understand when and why each design is used. Now, there are 4 types of non-experimental research design: descriptive, comparative, correlational, and developmental. In non-experimental design, there's no experiment involved, unlike with experimental research design, which means the researcher does not manipulate any variables. In this design, we're not introducing an intervention or treatment like we do in experimental or quasi-experimental design. And because of that, non-experimental research design does not infer cause and effect relationship. In other words, we can say that one variable causes another. And here, we only observe, describe, or explore association. So when do we use non-experimental designs? We use them when our goal is to construct a picture of a phenomenon, to describe what's happening, and to do it quantitatively using numbers and statistics. For example, maybe we want to describe the stress levels of nurses working during a pandemic. Non-experimental designs are also used when we want to test relationships or differences among variables. For example, to see if there's a relationship between job satisfaction and intent to live among nurses, or to compare stress levels between ICU and medical surgical nurses. Because we're not intervening or manipulating variables, non-experimental designs are often used when manipulation would be impossible, unethical, or unnecessary. The key here is we're observing and measuring, not changing anything. On the slides right now are some of the examples of research questions that doesn't involve any manipulation and can be best answered using non-experimental research design. For you to be able to understand how non-experimental research design is different from true experimental design and quasi-experimental design, again, I want you to remember the 3 elements in experimental design: randomization, control, manipulation. We said true experimental design involves the 3, while in quasi-experimental design, randomization is not present, and in some cases, there is no control group, but there is a manipulation because in quasi-experimental design, we also introduce intervention. In non-experimental design, these 3 elements are not present. We do not randomize participants into groups. The second one, we don't have any control group. And the third one, it doesn't involve manipulation because we're not intervening or introducing any interventions to the group. Now, what are the reasons for conducting non-experimental design? First, situation in which the independent variable cannot be manipulated. Now, what are those variables that cannot be manipulated? For example, age. We cannot change or manipulate age. And the second one is situations in which it would be unethical to manipulate the independent variable. I want you to look at the PowerPoint. Birth weights, salt intake, these are variables which is, when manipulated, can cause ethical implications, and hence non-experimental research design is used. Now let's talk about the types of non-experimental design. Non-experimental design is broadly classified into survey designs and relationship and difference designs. Under survey design, it could be a descriptive research design or it could be comparative research design. Under relationship and difference design, it could be correlational or developmental. In the next few slides, we're going to discuss how these types of non-experimental designs are different from each other, and we're going to present actual example of research utilizing these designs. Now, let's talk about the different types of survey designs. First, descriptive research design. This design aims to gather information to describe characteristics of a population or particular phenomenon at a specific point in time. Now, this type of survey design is primarily used when our goal is to simply describe what exists. In here, we're not trying to compare groups or establish cause and effect relationship. This type of research design answers questions like, what is happening? Or, what are the current conditions or practices without manipulating variables? For example, if we want to know the percentage of nurses in our hospital who are satisfied with their job, or the average number of nurses hours worked per week, in here we can use a descriptive survey. We're just painting a picture of the current situation. Examples include surveys that assess attitudes, opinions, behaviors, or demographics. Now, what are the pros and the cons of descriptive survey design? First, it's very simple, cost-effective, and it gives us a clear snapshot of a population at one point in time. However, there are cons with descriptive survey design. It doesn't explain why things are the way they are, and in this design we can compare groups or identify cause and effect relationship. Now let's try to look at this actual research conducted by Amini et al. In 2023, which aimed to assess the incidence of workplace bullying and occupational burnout among nurses in critical care units. About 62% of the nurses had moderate emotional exhaustion, 59.8% had moderate depersonalization, and 46.2% had a moderate individual achievement. 75.5% faced workplace bullying. In here, the phenomenon of interest or the variables were bullying and burnout, and you can see it on the slides. In their research, they just simply describe the percentage of nurses who are experiencing bullying and burnout. However, the researchers did not do any effort to correlate these variables. Hence, it is called descriptive design. Now let's talk about comparative survey design. This survey design aims to compare two or more groups on certain variables to determine similarities or differences. This type of survey helps us explore how two or more groups differ on a particular variable. In here, instead of just describing what exists, we are making comparison. It answered questions like, how does Group A differ from Group B regarding a specific characteristic? For instance, we might want to know, is there a difference in job satisfaction between nurses working in the emergency department and those in the intensive care unit? Or, do male and female nurses differ in terms of perceived workplace stress? This design is often used when researchers want to explore relationships or differences between categories. Now, comparative survey designs has its pros and cons as well. When it comes to pros, comparative survey design helps identify differences between groups and can guide further research or intervention. However, the problem with comparative survey design is that it still can show cause and effect, and the differences between groups may be due to other factors we didn't measure. Okay, at this point, we're going to look at how comparative research design is conducted. And the study of Bartlett et al. 2016 is a clear example of a comparative research design. In their study, they examined the sources of stress among nursing students and compared stress levels and selected mental health indicators between nursing students and the general student body. Nursing students were found to have significantly more stress, anxiety, sleep disturbances, and stress-related illnesses than general student body. Now, take note that there are two groups of participants in here, nursing students and general students. And aside from that, in their research, there was an effort to compare the groups based on selected variables, stress and health indicators. Hence, it is called comparative research design. The next type of non-experimental research design is correlational research design. Correlational designs is very important because it helps us examine the relationship between two or more variables. And in correlational research design, we study whether the variables co-vary, meaning when one changes, does the other change too? And how we measure how strong the relationship is. Now, when we talk about correlational research design, there are two types of correlational design. First is descriptive correlational, and the second one is predictive correlational. Now, the first type of correlational design is called descriptive correlational design. This type of correlational design describes the relationship between variables without trying to predict anything. On this slide, you can see two boxes, variable 1 and variable 2, and you see a double-headed arrow, which means that this correlational design aims to describe the relationship between variable and variable 2. Now, I'm going to give you a specific example, a study conducted by Avzi and Ayaz Al-Kaya in 2022, which identifies the anxiety level, social support, and satisfaction with the ICU among 250 family members of patients. The study concluded that anxiety levels of the relatives of the families were high, their social support and satisfaction with the ICU were at a moderate level. Most importantly, the research showed that there was a correlation between anxiety levels, satisfaction with the intensive care unit, and perceived social support of the families. Notice that in their analysis, they just examined whether anxiety level, satisfaction, and social support, these are variables, if they are correlated or have relationship. Now, what are the pros and the cons of descriptive correlational design? First, descriptive correlational design provides a snapshot of how variables are related to each other. It's very simple and useful, especially if your goal is just to explore relationship for the first time. However, the major cons of descriptive correlational design is that it does not predict outcomes. It only describes relationship. And because of that, it does not prove cause and effect relationship. The second type of correlational research design is called predictive correlational design. This type of correlational design tests whether one variable can predict another variable. Now I want you to look at our PowerPoint slide again with two boxes, variable 1 and variable 2, and you will see a one-headed arrow which suggests that this type of correlational design aims to examine whether one variable can actually predict the other variable. Now, another specific example on this type of correlational design is the study conducted by Labraga and De Los Santos in 2020, which examined the relative influence of personal resilience, social support, and organizational support in reducing COVID-19 anxiety among nurses. Based on their analysis, they were able to demonstrate that social support, personal resilience, and organizational support predicted COVID-19 anxiety. In their study, it was clear that the three variables were examined whether they can predict COVID-19 anxiety among frontline nurses. Now, the next type of non-experimental research design is developmental research design. Now, developmental research designs are special because they don't just look at relationship or differences at a single point in time. Instead, developmental research design focus on how things change over time. In other words, these designs use a time perspective to study growth, development, or trends. Now, there are three types of developmental research design. First, cross-sectional. The second one, longitudinal design. And the third one is case control design. Now, the first type of developmental research design is called cross-sectional design. Now, what is cross-sectional design? In a cross-sectional study, data is collected at one point in time, either from one group or several groups, and the very purpose of cross-sectional design is basically to provide a snapshot of the variables of interest. Now, this design is very important because it captures the current status or characteristics without following participants over time. Now, for example, you wanted to survey a group of nurses once to assess their current stress levels. You could use cross-sectional design. Or it could be that you wanted to survey new graduate nurses, mid-career nurses, and senior nurses at the same time. And then that could be cross-sectional design. Now, I want you to look at the lower portion of the PowerPoint in which you can see a long red arrow pointing in one direction, and you can see in here that the data is collected at time 1 only, and that is cross-sectional design. Now, what are the pros and what are the cons of using cross-sectional research design? Of course, cross-sectional design is quick and cost-effective. Why? Because data collection happens only once. And the second one is this type of research design is very useful for understanding the current condition or situation or status of a certain group. However, cross-sectional design has also some disadvantages. Because data is collected at a one point only, this study design will not show you how individuals change over time. Now, on the slide right now, you can see an actual research study conducted utilizing a cross-sectional research design. It was conducted in 2021 by Jalili et al., which aimed to describe the prevalence of burnout among healthcare professionals dealing with COVID-19 patients. This study was conducted about 2 months after the onset of the outbreak. A total of 326 persons, or 53%, experienced high levels of burnout. The average score in emotional exhaustion, depersonalization, and lack of personal accomplishment was 26.6, 10.2, and 27.3. These are dimensions of professional burnout among professionals. Now, take note that their study was conducted at one point in time only, and that was 2 months after the onset of the outbreak. This is a classic example of a cross-sectional study. Another example of developmental research design is called longitudinal research design. In some other books, we call it as cohort research design, or it can also be called as repeated measures or perspective research design. Now, longitudinal studies follow the same individuals or group over an extended period. In this type of research design, researchers collect data repeatedly at multiple time points. Now, I want you to look at the PowerPoint slides right now. In the lower part, you will see again a red arrow pointing in one direction, and notice time 1, time 2, and time 3, which means that in longitudinal research design, data is collected multiple times over an extended period. Now, this design is very important if our goal is to observe how specific behaviors or variables develop or change within the same people. For example, stress, or for example, anxiety, or for example, knowledge. And we wanted to see whether these variables changes over time. Now, this type of research design has a lot of advantages, but it also have some disadvantages. First is longitudinal research design provides strong evidence of real change and development in individuals. The second one is since data is collected multiple times, it helps us identify patterns and possible predictors of change. However, the problem with longitudinal research design is that it can be very time consuming and costly because you are collecting data over an extended period for multiple times. And another major problem of this research design is that it requires a lot of planning and sustained resources. And most importantly, attrition is a major challenge of this design, which means that participants may drop out over time. And this could significantly affect the validity of your study. Now, on the slide right now, you will see an actual study conducted by Moore et al. 2020 using longitudinal research design. In their study, they measured the quality of life in patients and their partners at pre-dialysis and over the first 12 weeks on dialysis, and to investigate quality of life during this crucial period. Patients and their partners completed the study measures on 3 occasions: baseline, pre-dialysis, and 2 follow-ups after 6 weeks and after 12 weeks after starting dialysis. The results showed that patients reported significant improvement in their general and physical quality of life after starting dialysis. Partners' general quality of life worsened after patients started dialysis, but improved by 12 weeks. If you try to look at this study, you will see that the data was collected 3 times, at baseline, after 6 weeks, and after 12 weeks. And the intention of the researcher is to see whether or not the quality of life of patients and their partner deteriorates in time. Now, the third type of developmental research design is called case control. In some other books, it is called as ex post facto. In some other books, they call it as retrospective. Now, in case control design, researchers compare people who have a certain condition or outcome with those who do not, and look back in time to identify potential causes or risk factor. In other words, in this type of research design, the dependent variable or the outcome has already been impacted by dependent variable. And in this type of research design, the researcher attempts to link the outcome or the present event to events that occurred in the past or the cause. So basically, it is called as a retrospective research because you look back in time to identify the potential cause of the current outcome. On the slides right now, you will see an actual example of a case control study, which was conducted by Wang et al. In 2021, where they investigated the dose-response relationship in a retrospective observational study of 921 patients treated for advanced stage non-small cell lung cancer. Smoking history was obtained from patients and recorded. In advanced lung adenocarcinoma, double smoking pack years was associated with an increase in tumor mutation burden, whereas doubling smoking 3 months was associated with a decrease in tumor mutation burden after controlling for age, gender, and stage. In other words, if you try to look at the lower part of the PowerPoint slide, the current event or the outcome or the present situation is the presence of tumor or cancer. Now, the researcher wanted to know what causes the tumor or cancer mutation by using case-control study. In here, the researchers examined smoking history retrospectively and analyzed whether this exposure contributed to tumor and cancer mutation. Now, what are the pros and the cons of case control design? Well, case control design is very efficient for studying rare outcomes or diseases. And normally, this type of research design is generally faster and less expensive when compared to longitudinal studies. Because in here, you utilize existing data already. Now, what are the cons? One is that since you are collecting data retrospectively, you basically rely on participants' memory or existing records. And this can be inaccurate or it can be incomplete because of the recall bias. And because it's retrospective, which means the data is collected retrospectively, it can suggest association, but it cannot prove causation. In general, non-experimental research design has a lot of advantages as well as disadvantages. Some of the advantages is that it is considered as the most efficient design to collect large amount of data. And of course, it is most effective. However, non-experimental design often do not yield causal inferences, which means it cannot determine cause and effect relationship, unlike with experimental research design. And selection bias is very common in non-experimental design. And of course, there's a higher risk of confounding variables influencing the result. Now, going back to the hierarchy of evidence or the level of evidence, you might wonder where non-experimental research fall. So basically, if you look at the hierarchy of evidence, non-experimental studies are considered level 4 and the center of the hierarchy, just below the experimental and quasi-experimental studies. For our session for today, we have an in-class activity called Quantitative Research Design Matching Challenge. Take note, this is an individual task. In here, you will be presented with research articles. And your goal is really to review the research question or hypothesis. You need to read the title and the abstract of the articles provided. And your goal in this in-class activity is to match each article with the appropriate type of quantitative research design. Take note, each article is used only once, and each type of quantitative research design is assigned once. Okay? Now, I want you again to remember what are the different research design, both experimental and non-experimental, that we have discussed. Now, after completing the task, there are a few questions that you have to respond to at the bottom part of the canvas that we're going to use for this in-class activity. Again, good luck with your in-class activity, and that concludes our session for today.